having a deviated septum just by itself, forget about snoring, forget about mouth breathing in the mainstay. Having a deviated septum increases your chances of having an irregular heartbeat, what we call an arrhythmia, of the nature that you may need lifelong medication or may need electrical shock therapy or special what's called ablative therapy to the heart because of that irregular heart rate. And what happens sometimes actually is that people have this blocked nose underlying tendency but not actually had the heart rate problem, and they'll come in and have surgery, and with the medications that we use and because the heart was fragile, that can actually trigger them into an arrhythmia which was never there before, simply because their heart was vulnerable or primed or susceptible to it. And that can be the first time that it sort of becomes evident, and they go, oh, well, you caused my heart to have a problem now. It's like, well, no, actually what was going on is that you had a condition that was priming your heart for this. This was just the straw that broke that back in terms of this now taking a life of its own. So it can cause that. It can cause deviated septum can cause high blood pressure. It can cause high blood pressure in what's called the systemic circulation. So when they do the blood pressure cuff, that's the blood pumping through general parts of your body. But it also pumps blood through the lungs. That's called the pulmonary circulation. So we have pulmonary for lungs and systemic is everything else. So you can get high systemic blood pressure, high pulmonary blood pressure. You can get the heart struggling and the heart failing, all because your nose is blocked. And the research shows when we go and unblock those things, it can have a beneficial effect to those cardiovascular conditions. So that's just a little bit about adult deviated septums.